Hey folks, it's Dr. Gilchrist, and I am here today to talk to you a little bit about occupational health and stress on the job. So here's kind of what we're going to cover, and I want to make sure that you have an opportunity to really listen to this before you take your third exam. So I'm probably going to post this a little bit sooner than Monday, just so you have this and you have time to really listen to it before taking that test. So we're going to cover occupational health and work safety, particularly things related to accidents, disease exposure, noises, harmful substance exposure. We're going to talk a little bit about shift work, in particular, the pros and cons of things like night shift and long shifts. And then finally, we'll finish up by talking about sources of job stress and work and how this relates to things like burnout and work-life conflict. So we're going to go ahead and start and talk about occupational health and work safety. Now, one of the things that we're going to find is that many jobs out there expose employees to dangerous situations or situations where they might become injured. So I'm thinking very, very quickly of this, of an Office episode that I very much like about safety training, where there's clearly a difference between the safety training for men working in the warehouse, where they're lifting objects, operating heavy machinery, versus the people up in the office who are basically being told, oh, you might get cold. Here's a sweater. You might get carpal tunnel. Now, obviously, those are very different types of issues, but it's very, very hard pressed to find a single job that does not potentially expose an employee to either danger or, to a lesser extent, some type of injury. So there are a variety of jobs. We're going to talk about some of the risks associated with each of them. So here is a case of a firefighter. This particular person could be exposing themselves to harmful chemicals by smoke inhalation. They might have lifting injuries. They might injure or hurt themselves. They might burn themselves, and they could even potentially die. This is a dry cleaning facility. This is a particular case where you could potentially be exposed to harmful chemicals. If it's a factory, there might be machinery issues that could potentially hurt you. There could be repetitive strain injuries. If you're working as a semi-driver, obviously motor vehicle accidents and driving over very long periods of time can be a problem. If you're a police officer, we actually know that increases the risk of physical assault. Other jobs, like being a cab driver, will also do that. And if you're working in healthcare, obviously, we're kind of seeing on a massive scale right now how this exposes you to infectious disease. In addition to that, we know that for people that are working as nursing home aides or psychiatric nurses, there's a greater risk for physical assault. There could be lifting injuries because often nurses have to help lift people. So it's not just exposure to infectious disease. There can be a variety of different types of accidents or injuries that can happen on the job. So when we talk about these factors, when we talk about how we can reduce the risk of injury, encourage people to be safe, and we're trying to foster better employee well-being, we are getting into an area called occupational health psychology. This is a subfield of psychology that studies the different factors that influence occupational health and safety, as well as employee well-being. Generally, one of the things that we are going to find is the jobs that are physically oriented. So jobs that involve lifting things, constantly grasping for things, or things like that. Physically oriented jobs are going to have direct physical effects. If you work in a warehouse and are constantly lifting things, you are probably running the risk for bodily physical injury. So this can also include things like accidents, exposure to loud noises, exposure to either toxic or infectious substances as well. So jobs that have this physical nature, that involve working with other things, and not just white collar information based jobs, there are going to be direct physical effects. So one of the things that we're going to find is that accidents on the job can be common. Accidents are generally defined as events that cause immediate injury, and they are not intentional. And one of the things that we find is that it is the fifth leading cause of death for Americans. That's especially true if you're under the age of 45. And at least 10% of reported injuries and accidents occur at work. Now, generally, because of a lot of technological advances that we've had, accidents are actually far less common than they used to be. They used to be a lot worse because of that. But accidents are things that your employer generally wants to try to reduce as much as possible. Accidents mean time off of work, either because you can't do the job, or for you to be able to do your job, you need to take time to heal and possibly rehabilitate. So accidents mean time off from work, and this means you're losing time, you're losing money, and you're losing productivity. So employers have a vested interest in trying to make sure as much as possible that their employees are behaving safely and are acting safely to reduce those accidents and reduce those negative consequences. Now, what type of accidents are most common at work? You can actually find this in page 272 in your book. So generally, I'm going to start with the least common and work my way up. Fires and explosions are basically 3%. By the way, this comes from major types of fatal work accidents for 2008. And this is from the Census of Fatal Occupational Injury Charts from the Department of Labor that was published in 2010. So this is data from 12 years ago. Fires and explosions accounted for 3% of fatal accidents. Exposure to harmful or toxic substances accounted for 9%. Falls accounted for 13%. Violence accounted for 14%. Contact with objects or equipment accounted for 18%. And by far, the largest type of accident that was most common at work are motor vehicle accidents, accounting for 43% of all types of accidents at work. And remember that we are talking about fatal accidents in this case. Odds are pretty good for non-fatal accidents. These numbers are probably going to be a little bit different. Now, let's talk about the jobs that are most and least likely to experience accidents. So generally, we're going to find, and again, this kind of comes from page 272 in your book with the fatal accident rates for several categories for 2008. Education and health services, basically the accident rate there is 0.8. Leisure and hospitality is about 1.8. Retail is about 2.4. Government is 2.4. And services and manufacturing is 2.4. And services is about 3.5. So these are the jobs that are least likely to experience these fatal accidents. Now, on the other hand, and by the way, this 2.4, by the way, when I say those terms, I'm talking about accident rate per 100,000 workers. So the rates for these are all pretty low. Let's take a look at the jobs that have the most common accidents. So construction. So that's about 11 fatal accidents per 100,000 workers in that field. Transportation and warehousing, about 17.6 accidents per 100,000 workers. Mining, incredibly dangerous, about 25.6 accidents per 100,000 workers. Mining can be incredibly dangerous. You're working in these spaces. Exposure to toxic substances and toxic gas is pretty common. Cave-ins can also be incredibly common. But by and large, the most dangerous profession is agriculture. In particular, things like fishing, things like forestry, and things like hunting, which account for about 32.5 fatal accidents per 100,000 workers. So those are some pretty dangerous jobs, and mining and agriculture jobs, in particular logging, has been identified as one of the most dangerous professions to work in. And by and large, agriculture and these mining jobs are going to be far more dangerous than things like construction or transportation or warehousing. So how can we prevent these accidents? Well, there are a variety of different things that we can do. One of the first big things that we can do is we can utilize what we've learned about human factors and design better equipment that is safer to use and easier to use. And we can also train our employees. Where'd I go? No, I hit the wrong button. Okay. So this can include things like a handle release switch for push lawn mowers. So oftentimes we'll kind of find that when you push a lawnmower, if you don't have a handle release switch, that lawnmower is going to run off on its own and it could potentially run you over. That may include things like encouraging people to use safety goggles. So we want to make sure that we have a good climate for safety, and that safety training is really critical. If your higher ups do not take safety seriously, that is something that is going to be modeled for the people below those senior people. If the people on top are not taking safety seriously, there is no reason for people below them to take safety seriously. Now, you will generally want to consider both the workplace situations, like what's going on in the workplace, what does our equipment look like, and the underlying accident causes to understand how you can make things better. But one of the things that we find is that it's often difficult to get employees to cooperate. And that's because oftentimes these safety measures seem either way too, a little bit, like they're almost so easy. Like, why are you even telling us this? Of course it's important to be safe. Despite all of that, if that were the case, and if these safety guidelines were clearly common sense, more people would be following them. So it's really critical that a good shared climate, a high safety climate, is going to be really, really key. People basically need to see that the managers and the senior personnel are taking safety seriously and are modeling that for lower level employees. So generally, one of the things that we will find is that part of the reason that cooperation is so difficult is because safety devices can be really inconvenient. Equipment can be uncomfortable. For example, I have a cloth face mask that I am probably going to be using when I'm out around people in crowded spaces. That mask is incredibly uncomfortable. It is hot, and on hot days, it's just very, very difficult. And so if we find these safety measures a hindrance or annoying or uncomfortable, we're not going to use them, which is why the higher ups and managers and administrators need to model that behavior for employees. Now, what in the work environment leads to accidents? If we focus on productivity above all else, one of the things that we will find is that the greater your emphasis on productivity is, generally, the less safe you're going to be. So generally, pay incentive systems, so this is based off of work by Kaminsky discussed in your book, pay incentives, so like that piece rate work that emphasizes pay on how many units you produce, that tends to be less safe than assembly line jobs where you're being paid per hour. So it's not about how much you make in those cases. So focusing on productivity above all else actually makes conditions less safe. If you are stressed out either in your job or outside of your job, we know that that is going to lead to a greater likelihood of workplace accidents. Generally, people who have greater job satisfaction and people who have positive attitudes about safety are a lot less likely to experience accidents. So there are some individual differences. Generally, people who are high in conscientiousness, that big 5 factor, they're going to be less likely to experience accidents. And people who are emotionally stable, that is, they're low in neuroticism, are also going to be less likely to experience accidents as well. So those can play a role. So like I said, conscientiousness and emotional stability are negatively related to accidents. And as we've seen as well, if the workplace emphasizes goal setting at the individual or the group level, we're going to see fewer accidents as well. So let's talk about a few. So we've talked about accidents, which can happen on the job. Exposure to disease is common in healthcare. That is especially true right now. The fatality rate and the hospitalization rate for healthcare workers with respect to COVID-19 is far more than that with the average person right now. And that's largely because they are coming into greater contact with people who are ill. And additionally, odds are pretty good because they're tending to so many sick people, they are probably getting a higher viral load than the average person might. So this is certainly a case right now. Exposure to disease in healthcare professions is going to be a fact of life. So generally, and to a lesser extent, there are a lot of other jobs that can lead to infectious diseases. I generally tend to find that when y'all come back from winter break and a flu starts going around or a cold starts going around, I have a greater tendency of getting it. When you're surrounded by people, when you're interacting with the public, infection is common. It's part of the reason why we're focusing on social distancing. Now, in the healthcare professions, these were actually developed out of HIV and AIDS epidemics, as well as hepatitis B, which is fatal. We do actually have a protocol of protection against diseases, which are known as universal precautions. And these are basically a set of procedures that basically keep people from coming into contact with bodily fluid. So there are a couple of different things that are involved in universal precautions. So this also includes things like disposing of sharp objects like needles or needles that you might use for blood draws in a sharps container. Utilizing disposable gloves for blood or for other bodily fluids, disinfecting body fluid spills immediately with disinfectant, and then also use of aprons and masks. Now, despite the fact that these universal precautions are in place, very few people actually follow them, even though they're very highly effective when they're followed. Now, obviously, given the current state that we're in, I have a feeling these are being followed as often as they can be, despite the fact that PPE, this protective equipment, is hard to come by right now. But what's interesting is that prior to all of this, we actually find that use of these different protections and universal precautions, generally what we're going to find, compliance is high for certain things, but not for others. So most places actually fail to follow to the letter the universal precautions. And generally, compliance will vary by guideline. Generally, we tend to find that disposal of needles has a really high rate of compliance. And this is really important for nurses and for nursing students to learn. They get this from the get-go. What we tend to find is that accidental needle sticks and blood draws and other sharp injuries can be really common. So being able to dispose of those needles is really important. At least as of this 2008 study, use of masks were actually pretty low. Odds are pretty good. Over the coming years, I would not be surprised if this changes quite a bit. Yes, we're going to talk about loud noises. So, exposure to loud noises is common in many different jobs. If you're working in construction, particularly if you're using heavy equipment, if you are utilizing jackhammers, if you work at an airport, especially if you're a baggage handler, or you're responsible for providing gasoline or food for a plane, if you're working in a mine or a factory, exposure to loud noise is quite common. And one of the things that's kind of interesting, and I'm going to keep this really short because this is more of a sensation and perception aspect. When we talk about the loudness of a sound, we are talking about a sound's intensity level. And one of the things that you may not actually know is that sound intensity levels are not linear in nature. So generally, if I increase, sound is typically measured in units called decibels. So, for example, traffic, which tends to be about 80 decibels, is not actually 2 times as intense as a bird chirping, which is about 40 decibels. It's much, much more than that. Likewise, if I increase the sound level by 10 decibels, that is an increase of 10 times of sound intensity. But if I increase it by 20 decibels, I've actually increased the sound intensity 100 times so. So let's kind of keep that in mind. Loud noise exposure without the proper protection can permanently damage your hearing. Extremely loud noises will often be very painful to listen to, and that's what makes them very, very easy to avoid. So sounds that are over like 135 to 140 decibels, you know to avoid those. Those hurt your ears very, very badly. It's these other loud noises that don't induce pain that can be incredibly damaging. In particular, continuous exposure to levels over 85 decibels, which is basically the equivalent of trucks, machinery, and traffic, can actually lead to permanent hearing loss over time. So generally, for a job with a very noisy environment, protection is necessary. That includes things like earplugs, that might include ear covers. I know that a lot of airline workers use those when they're dealing with planes, so we have to try to protect our ears. And I'll go ahead and stop here, and I'll see you next time.